we'd particularly like to encourage pregnant women, women who are hoping to become pregnant soon, women who are having fertility treatment or who are breastfeeding or have given birth recently to also come forward for vaccination. The reason that we can make this recommendation is because we have data from hundreds of thousands of women in various countries who have had COVID vaccination in pregnancy without any safety concerns being identified. The reasons why it would be beneficial to have COVID vaccination in pregnancy is because we know that even for healthy women, if you're to catch COVID during pregnancy, you are more likely to become severely unwell, to require hospital admission or to require intensive care treatment, and you're also 2 to 3 times more likely to give birth prematurely.
There's no evidence to suggest that the vaccine could affect your fertility. Many scientists have come out, and including the Royal College of Obstetricians and Gynecology, and confirmed that there's no plausible mechanism in which the vaccine could affect your fertility in males or females.
Although the overall risk of COVID in pregnancy and the impact on the baby is low, we know that in the latter half of pregnancy, women can become extremely unwell, requiring intensive care treatment, more so than similar-aged women who are not pregnant. There is a 2 to 3-fold increase in preterm births and a doubling of the stillbirth rate, although the risk is still very low. It is important that we encourage our women to get vaccinated, especially before the 3rd trimester. Risk is individualized for all our pregnant women. However, we do know that there are certain high-risk women, such as those with pre-existing medical conditions such as hypertension and diabetes, as well as those with high BMI and from a BAME, Black minority ethnic and Asian background. We mustn't forget those who are public-facing roles, such as those working in health and social care, as well as teachers and other occupations.
Women already have 2 types of vaccine in pregnancy. They have the flu and they have the whooping cough vaccine when they're pregnant, and they have been for many years. Both vaccines are not live vaccines, which is similar to the new COVID vaccine. So you cannot get COVID from having the vaccination, and the vaccination does not pass through the placenta. One of the positives is that when we've tested babies when they've been born and we look at their cord blood, we found that they have antibodies in the blood if you've had COVID or you've had the COVID vaccination. So what happens is you give on a good level of what we call passive immunity to the baby. If you're breastfeeding, this is also a benefit because we found that we have antibodies and they're present for many months in breast milk. So you pass on passive immunity to your baby that way as well.
In this country at the present time, if you require your first dose of COVID vaccine, you'll be offered the Pfizer or Moderna vaccines, simply because these are the vaccines for which we have the most data of use already in other countries. However, the advice is very clear that if you have had your first dose of COVID vaccine with the AstraZeneca vaccine and you have now found out that you're pregnant, then you should have your second dose with the AstraZeneca vaccine, because we hope with that to give you the most protection.
Cannot catch COVID from any of the COVID vaccines. All of them don't use any live virus, so the virus can't replicate, it can't get into your cells, it just produces immune response and then is removed from your body within a couple of days. In terms of the contents of the COVID vaccine, there is no animal content, no egg products, no material from fetal origin. Many of you who have allergies to a number of other things are also likely to be able to have the vaccine. But if you do want to double check it, it's worth checking on the MHRA website to see if you are allergic to any of the ingredients of the vaccine or having a discussion with your healthcare professional. The vaccine doesn't contain anything that can change your DNA. It doesn't have any microchips or any tracking devices. And the vaccine also, as previously discussed, cannot affect your fertility. So the rates we're seeing locally and nationally are some of the highest rates we've seen since the sort of January lockdown. And actually some of the rates that we've seen in Leicestershire in the past few weeks have actually been some of the highest rates we've ever seen in the pandemic. We also know that the variant that's circulating at the moment, so the Delta variant, or the Indian variant as some people may know it as, is really transmissible. So what that means is it's really easy to catch, and that this variant is easier to catch than some of the other variants that we've had circulating previously. As a consequence of that, we are still seeing some hospitalisations, and we do know that pregnant women are at higher risk of hospitalisation due to more serious complications of COVID, particularly in your last trimester. So it's really, really important that you do consider having your vaccination as early as you can to protect yourself, your family and your friends. So keep outside and keep that fresh air flowing as much as possible. If you do have symptoms, get tested as soon as you can. And there is also the asymptomatic testing that you can do on a regular basis, because we know that 1 in 3 people who have COVID don't have symptoms. You can wear a face mask or a face covering if you're in crowded places or indoor spaces. And we do know that there is, that protects other people, but there is a small element of protection for yourself as well. You can use your COVID app. And also there's a real importance around that hand washing. So doing that hand washing for, your 20 seconds and really making sure that you do the best that you can with that. So we can all do our bit, and let's keep life moving. Thank you.